I want to thank you for joining today's update on COVID-19 in North Carolina. As of today, North Carolina has 5,859 confirmed cases, 429 people in the hospital, and sadly, 152 deaths. We know that this disease includes an extra amount of sorrow since loved ones cannot be at the bedside, and we continue to hold all of those suffering from this virus in our thoughts. Earlier this week, I laid out our path forward to a new normal dependent upon testing, tracing, and trends. I wanted to share some key updates about our work on that front. On testing first. North Carolina has made great strides, but we have more work to do. We've conducted at least 73,000 tests, which is a long way from where we were a month ago. In fact, testing in our state has increased by 88% over the last 2 weeks. But we need testing to be more widespread, and we need to use it to give us a better indication of where we are in this fight. Today, we announce a partnership with 3 of our state's medical universities to use testing and tracing to help us determine how far the disease has spread in North Carolina. This research is part of a coordinated statewide effort to learn more about what percentage of people have no symptoms and to better understand the true number of COVID-19 infections in our state. The University of North Carolina, East Carolina University, and Duke University are joining with us in this project, and we're confident that their expertise will tell us more about how the disease spreads. We still know that more help is needed from the federal government on testing. The President yesterday shared guidelines for the country to be able to reopen. It was good to see that many of the national criteria match what we're doing here in North Carolina. But I and other governors around the country have been clear. We still need assistance with testing supplies and personal protective equipment. The President has left the responsibility to me as governor to make decisions about how and when we ease restrictions. I accept that. But when governors are faced with global supply chain breakdowns when it comes to supplies and equipment, the federal government must help more. And they have some, and we appreciate it, but not enough. Easing restrictions here in our state without enough masks, gowns, and gloves is like setting off on a 3-day camping trip with enough food for just one night. We need all of these supplies to collect more test samples and to ensure hospitals and first responders have what they need. North Carolina now has 13 labs, public, private, and hospital, that have performed at least 73,000 diagnostic tests. But we need more. We're doing our part, and we've set up a testing surge group. It's going to be a work group that Dr. Cohen will tell you a little bit more about. They're going to be important in this process. On tracing, we're continuing to deploy groups to hotspots like nursing homes to find out where the virus has spread and warn those who might be at risk. That's another place we'll need to surge more people and deploy many more tests as we work to ease restrictions in our state. Finally, we're looking every day at our trends in cases, people in the hospital, and those seriously ill. We want those trends to be headed down so that North Carolinians can restore their lives and their livelihoods. The federal guidance yesterday says we need a downward trajectory in certain categories, along with the ability to test and trace in order to begin the phase-in process of easing restrictions. I know that we can do this. I understand that people are anxious to know which orders may be eased first and when that's going to happen. There's no perfect sequence or timing, but there is health guidance, business guidance, and common sense. We will put these together with each of our three areas, testing, tracing, and TRIDS, to make those decisions and get more people back to work. Now, I know you're probably getting tired of hearing me say this, but as we head into another weekend, please remember that every day you stay at home and practice social distancing is another day saving lives and getting us closer to reopening more of our economy. I want to congratulate North Carolinians. You've made great efforts to keep yourselves and your family safe. It is working. With me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Karen Magoon and Valerie McMillan are providing American Sign Language. And behind the scenes are Jackie and Jasmine Mativier. They are our Spanish language interpreters. I'm first going to recognize Dr. Cohen. Dr. Cohen?
Thank you, Governor. As you've mentioned, for North Carolina to stay ahead of the curve, testing is going to be a key component of our work. Today, our testing surge work group had its first meeting, and I want to thank our public and private partners for coming together. We have folks from hospitals and commercial labs, as well from primary care, pharmacy, and other outpatient lab settings. And they came to that meeting ready to meet the challenge of helping North Carolina increase COVID-19 testing and beating this virus. This group is charged with first increasing transparency to more fully understand what everyone is doing and planning so we can appropriately further plan to increase our collective state testing capacity. The goal is to get to widespread testing, as the governor mentioned, meaning that people with symptoms can get a test and know their results and take appropriate actions to prevent exposing others. That will take a lot of work. It's going to take having sample collection sites near folks. It's going to have doctors and clinicians having both the supplies and the sample collection materials and the personal protective equipment necessary to do the work. Doctors and clinicians will need to know which labs have the capacity on any given day to process those tests, and labs will need to be able to easily share those results back with patients and clinicians and our public health teams. There's a lot of pieces here. As we think about staying ahead of the curve in the coming weeks, the Testing Surge Work Group will advise us on how to increase the number of tests labs can process each day and increase the number of labs in different settings across the state. The work group will also advise us on how to expand the number of sample collection sites, again, making sure that there's access in communities all across the state. We want to expand the throughput of testing labs that have been being used, as well as integrate some of these newer rapid turnaround tests that are first coming on the market. And we hope to use new modalities that are currently being developed where people can self-administer tests, which will save on our need for masks and other protective equipment. Because as the governor said, we do need to address supplies as we do this work. Testing supply challenges are easing somewhat, but we are not out of the woods. As you continue to hear, having enough personal protective equipment for our healthcare workers is still a huge challenge. And so before I close, let me change gears for just a moment away from testing. This is the week of the young child. So I need to give a huge shout out to our early childhood teachers. You are our unsung heroes who care for and love and teach our children. I want you to know we value you and the child care programs you work for, and I know that you're working hard despite these uncertain times. We've been able to provide bonuses for teachers as well as financial support to our hard-hit child care programs. I just want to say thank you for all that you do.
And you all are hearing that not only from a great Secretary of Health and Human Services, but as a mom of a kindergartner and a second grader. So thank you for that, Dr. Cohen. We'll now hear from our Director of Emergency Management, Mike Sprayberry.
Thank you, Governor, and thank you for your leadership. Good afternoon, everyone. The State Emergency Operations Center has now been activated for 39 days for the COVID-19 response. As we have stated, this is an evolving response. We are constantly evaluating our response posture and are prioritizing the following lines of effort. Continued medical surge on planning, focusing on support of local jurisdictions and healthcare organizations, along with contingency planning for larger settings strategically located across the state. Hardening and protecting our food supply chain. Support to include staffing for our licensed care facilities and other congregate care settings across the state. An expansion of our logistics team to continue the aggressive sourcing, procurement, and dissemination of the vital personal protective equipment for our frontline healthcare workers and public safety partners. These priorities and actions we have taken as the State Emergency Response Team are allowing us to address needs related to COVID-19, as well as to set us on a better footing as we look over the horizon to what could come later this year. We know there are other events happening concurrently here in the state, as well as some major ones that can happen and will happen in the future. Having this unified command working lockstep has allowed us to align our actions across the State Emergency Response Team to enhance our all-hazards approach to preparedness and response. We continue to encourage you to support food banks around the state. We'll talk about this every day. They are doing great work to support an increasing number of people who need groceries. Please visit feedingthecarolinas.org to find a food bank near you. You can make a financial contribution or a donation of shelf-stable foods. I also want to take this opportunity to remind everyone of the important messages you've heard from Dr. Cohen in the past. For those who have lost work and lost health insurance due to the pandemic, remember that healthcare.gov is the website to visit for health insurance options, and also that all insurance companies in the state, including Medicaid and Medicare, are covering health care visits through telehealth. That's really important. As we continue to push through this together, I know these are difficult times for everybody, filled with a lot of uncertainty and escalating anxiety. For some, this pandemic is exacerbating pre-existing behavioral health conditions, and for others, it's causing the onset of mental health conditions such as anxiety and depression. I'm proud of the work that our teams are doing to ensure that people who need services have access to the right services at the right time, delivered in the most accessible places during this public health crisis. And we're grateful for all of our partners that are working with us to creatively serve people during this trying time. In particular, I want to make sure everyone is aware of our Hope for NC helpline. The Hope for NC helpline connects North Carolinians to additional mental health support systems that can help them cope and build resilience during times of crisis. If you're feeling anxious or depressed or just want somebody to talk to, please give us a call at 1-855-587-3463. We're here for you and unified in our focus on whole person wellness. Additionally, we released some guidance documents for our partners in the counties that outlines how we're supporting them to ensure the behavioral health and intellectual or developmental disability crisis response systems are sustained in the midst of this pandemic, and can find that on our website at ncdhhs.gov/COVID-19. We always want to give a special thanks to the residents of North Carolina for following the restrictions as outlined in Governor Cooper's executive orders. Your commitment to staying at home and maintaining social distancing is flattening the curve and ensuring this event is manageable for our healthcare system. Well, we thank you for that. So in closing, don't forget to look out for your friends and neighbors and call your loved ones daily. Guaranteed they're going to appreciate it. Thank you so much. And thank you, Governor.
Thank you, Director Sprayberry. And we'll now hear from our Secretary of the Department of Public Safety, Eric Hooks. Eric.
Thank you, Governor. Yesterday, we announced a proactive and aggressive approach in our efforts to contain and reduce the spread of COVID-19 at one of our correctional facilities, Noose Correctional in Goldsboro. Prison officials secured and accomplished testing all 700 offenders at the facility, as well as providing access to tests to staff who wish to be tested. This strategy is the result of a strong collaborative and coordinated effort between the Divisions of Prisons Incident Command Team, the Department of Health and Human Services, the State Laboratory of Public Health, LabCorp, and the Wayne County Health Department. We have medical protocols in place to handle this, and it is better for us to know up front what we are facing so we can do what is necessary to stop the spread. We knew that there was a risk that others were positive but not showing any symptoms of COVID-19. Test swabs were taken Wednesday from around 300 offenders who were viewed most likely as having had exposure. We have the results of those tests, and over half of those came back positive. The remaining 400 offenders tested yesterday, and the entire staff of around 250 people at Noose were offered the testing for COVID-19. We are learning from our prison staff at Noose who report that approximately 98% of those newly tested people who tested positive are showing no symptoms from the virus. This is just not good or helpful information for prisons, but the wider public health community. Additional medical and security personnel are being dispatched to the Noose Correctional Facility to bolster the men and women who are treating COVID-19 positive offenders. Our top priority is everyone's health and safety. We now have better intelligence on the extent of the problem that we're facing at Noose. Working with local and state health officials, we will do everything we can to stop the virus so it does not continue to spread. Our prison's leadership will be available after this press conference to provide more detail. The Division of Prisons has taken more than 36 actions to prevent COVID-19 from getting into the prisons and to mitigate its spread. A list of these actions can be found at our website at ncdps.gov. The outstanding work of our professional correctional staff, along with our troopers, emergency management, National Guard, and a host of other public safety and health professionals, should remind us all of the value of our frontline heroes. Thank you, Governor.
Thank you, Mr. Secretary. We'll now have questions from the media. If you can identify yourself and your organization when you ask a question, we would appreciate it. First question, please.
Our first question is from Michael Hyland with CBS 17.
I wanted to ask a little bit more regarding the testing capacity you were talking about. Can you give us a better indication? What level do we need to get to? Do you feel like that we would be comfortable moving forward with reopening businesses, reopening more parts of our state's economy? When you say we need more testing supplies, just how widespread does testing need to be? Thank you.
That's a great question, Michael, and we are making significant progress, having increased our testing 88% in the last 2 weeks. I want us to feel good about whenever there is an outbreak in our congregate care facilities, that we can go and test all the people there and to test staff, that we have a robust way to make sure that we're testing all of our frontline responders. I want us to be able to test people who have symptoms, and I want us to even go beyond that, which is what we're beginning to do with our partnership that we've announced with the 3 universities today, to get a better scope of the kind of problem that we're facing here with COVID-19. So we want to increase all of that. The good news is that we have a lot of lab capacity to run those tests once we get the samples there. The biggest problem is having the supplies and the personal protective equipment for the people in the field who are collecting those samples. That's where the biggest bottleneck is. That's where the issues lie. We're working every day to get personal protective equipment into our state. I'm feeling better every day about where we are in our testing process, and we're going to continue to bolster it. We do want more help with the federal government, and the biggest help they can provide us now is more supplies to help us, more personal protective equipment to help us do the testing that we need. But we're working hard on expanding, and we're going to continue to expand. And we want to get to the process of easing restrictions and beginning to open more of our economy in North Carolina. We know we need to do that. We're aiming toward doing that right now. Dr. Cohen, would want to add to that?
The only thing I would add, or two things. One is it's not just throughput at the lab. We have to remember, as the governor said, that we need to also think about the sample collection and make sure that sample collection is available in communities across the state. And the other piece that I would remind folks, there are a lot of components to this, and we want to make sure that the capacity is in the right places. We're noticing in some parts of our state we have capacity in certain parts of our state and lack the capacity in others, but we know we need to have a statewide solution. That's why I'm excited about bringing this work group together with different perspectives, where they were having great dialogue about how do we have collective response to testing across our state. And so I know we have great private and public partners that are going to be tackling this with us. Again, we do need help from the federal government on supplies and those protective equipment, but I feel like we're on a good path, and we just need to continue to accelerate our work.
Next question, please.
Next question is from Lindsay Marcello with the Carolina Journal.
Hi, thank you for taking my question. I'd like to know, what business leaders and industry representatives are being consulted in the decision to start lifting restrictions and open up the economy? Thank you.
Thanks for that question. We have had many industry leaders on the phone giving us their thoughts about reopening the economy. Particularly the Retail Merchants Association has organized phone calls where we have had restaurant owners and bar owners, people on the ground telling us what it's like, what kind of conditions they would like to see as we reopen. We've talked to most all of the grocery stores, their chains regarding the restrictions that we put on the number of occupants in retail stores. We've been in constant contact with the Chamber of Commerce, which has continued to provide input to us. I just had a conference call with the North Carolina Federation of Independent Businesses, which is a group of small businesses in North Carolina. They may have been hit the hardest with all of this. So many small businesses that are hanging on by a thread, many of them that have been there a long time. They are giving us their input, not only about the kinds of ways that North Carolina can ease into opening back up, but also what they're dealing with trying to recover funding from the SBA under the Paycheck Protection Act. I think it's pretty clear out there that we need to provide more funding to our small businesses. I hope the federal government will in the next package, provide more help there. As with the state legislative budget, I know that many of us agree that we need to put more money into the Rural Center Golden Leaf cooperation that's going on right now to help provide small businesses with help, and I think a lot of people in the General Assembly, I want to do that. We'll continue to do that. And we'll keep those lines of communication open with all of those entities and businesses within those entities to let us know what they're thinking, because we do want to open up North Carolina. We want to open it up in the right way with input on businesses about how they can protect their employees, how they can protect their customers, and how they can get back to work so that we can put people back to work. Thanks. Next question, please.
Next question is from Nikki Hauser with WNCT-TV.
Yes, hello. Governor, looking forward to when we're able to start reopening. Will everyone in the state be on the same timeline, or do you see this potentially happening in the next couple of weeks?
Well, first, as we've looked at these restrictions in North Carolina, our goal has been to flatten the curve and to keep our medical system from being overwhelmed. The model showed us that without these restrictions, there's a good chance that our medical system would have been overwhelmed. So I appreciate the people of North Carolina abiding by these orders and the good work that they have done. I think it's been important that we have had a statewide standard. I think it's also important that some local governments have seen that they may need some stricter requirements, and a number of those local governments have as well. I think it's important for us to keep a statewide floor, and I think it's also important for local governments to continue to have the flexibility to do more with their restrictions if they need to. We are leaving open the idea of looking at regions of our state. It's almost impossible to look at it county by county, because a person can live in a county, and particularly I'm from rural eastern North Carolina. In some of our rural counties, you have someone living somewhere in one county, maybe working in another county, maybe going and visiting and family and having their fun in another county. So it's very difficult to just say there ought to be a certain set of rules in one particular county. But we have left open the possibility of looking at regions of our state and to look at the trends, the testing and the tracing in those regions of the state to see if there is some potential to have some different restrictions there. We aren't there at that point yet, but that's an option that we're keeping open. Another group of people that we have been in contact with are our mayors, our county commissioners, to continue to get input back from local governments, which I think is really important. Thanks. Next question, please.
Next question is from Bob Buckley with Fox 8 News in High Point.
Hey, Governor, and this may be as much for your staff that you have there as yourself, but the question that we had was, is the state either is the health department interested in or going to test people that exhibited symptoms before March, as far back as late December, January, because of the severe respiratory illness that was going around? And is anyone allowed to come in the health department to get tested, or are you curating and choosing those people?
Well, you may be referring to antibody testing that we want to deploy out there to determine how many people have actually had the disease and have recovered from it, to give us a better sense of scope. And I'll let Dr. Cohen talk about that a little bit, about what we are doing.
Sure, thank you. So yes, as the governor mentioned, there are different types of testing. Most of the testing we've been talking about today is when someone has active infection, when we think they have COVID-19 in the moment. They may be showing symptoms or they may not be showing symptoms, but when we are actually doing that test, we are looking for the presence of active virus. What I think you were referring to is, what if someone's had something that seemed like COVID, like cough and fever in the past, and they want to know whether or not they have had COVID and if they've recovered now. And in order to detect that, you would be doing something called an antibody test or serology test, which is different. It's a blood test. And so we are starting to see new serology tests come onto the market. Only one or two have at this point been approved by the FDA, but some are being tested, some even here in North Carolina, to help us understand, have people been exposed to COVID-19 in the past and already recovered? I think all of this information about people who have had the virus before and recovered, as well as who has that virus right now. Are they showing symptoms? Are they not? All of this information is important to bring together in a coordinated way so we get a good picture of understanding how has North Carolina experienced COVID-19 and what does this mean for decisions going forward in terms of either reopening or making other decisions about how to ramp up testing or ramp up serology and target appropriate populations that can give us the most information as we go forward. So stay tuned as we do all of that work in coordination. And again, as we do this, we need to be very sensitive to the fact that we need the supplies in order to be able to move forward effectively. Thank you.
Thank you. Next question, please.
Next question is from Harrison Miller with Business North Carolina.
Hello, Governor Cooper. Harrison Miller with Business North Carolina here. I was just wondering if there are any plans or proactive measures in place for small businesses in the state's rural counties. I know a few questions ago you mentioned expanding the Golden Leaf Bridge Loan Program, but I was wondering if you had any other specific measures or plans in mind.
You know, I believe that we're going to need a significant jump start to our economy. We do want to put more money into the loan program that both the Rural Center and Golden Leaf is putting into place. And we're also pushing Congress to replenish that supply of money through the SBA that got gone so quickly. That sent a strong signal that small businesses need it. So the most important thing that we can do right now is to get cash in the hands of working people, those who are unemployed, the stimulus checks that are coming from the federal government, and cash in the hands of small businesses so that they can stay afloat. I also think it's going to be important for us to look at pushing construction projects. We know that the Department of Transportation has some projects that need to continue to get done that would help boost the economy. The gas tax is low for them right now, and we may need to put some additional money there. I know that we've talked about bonds for our public schools, community colleges, and universities, and for water and sewer. Those kinds of activities can help to stimulate the economy and put more people back to work. We've also been working very hard right now to extend high-speed internet access. This has been a priority with my administration, our Department of Information Technology, and our Hometown Strong has been working very hard to expand high-speed internet access in the rural parts of our state. I convened a call a few weeks ago of internet service providers to say, hey, we know we've been working on this, but now it's more important than ever. Now we have children who are out of school and remote learning is needed more than ever. Now we have patients who may be afraid to go to the doctor, but who want to communicate with their doctor. Telemedicine is more important than ever. And these small businesses and farmers in our rural areas who aren't connected, we know how important that is to agribusiness and to commerce in rural communities. We need to get them connected. So now is a time to try and emphasize those areas as well. Oftentimes, a crisis will put a spotlight on problems that already exist. This pandemic has been no different in that regard. It shows that we have a lot of work to do in expanding internet access. It shows we have a lot of work to do to expand health care. One of the best ways we could help rural North Carolina right now is to expand Medicaid. We have over 1 million people without health insurance, and expanding Medicaid would help 500,000 to 600,000 North Carolinians get health insurance. And I'm not sure you can find a time when people have needed health insurance more than they need right now. A lot of things that we can do to help rural North Carolina, to help jumpstart our economy, to educate our children, and to get people healthier. And I think it's going to be up to federal and state government to help jumpstart this economy. And we're looking forward to easing these restrictions when all of the trends, tracing and testing gets into place, and starting to do some of the things I just talked about. Thank you for the question. Next question, please.
Next question is from Jonathan Alexander with the News and Observer.
Hey, I have a three-part question since we haven't really been able to get much follow-up. So I'm wondering, there have been a lot of inconsistencies in how counties are reporting nursing home outbreak information. Why isn't the state or DHHS releasing the names of nursing homes and counts and deaths instead of leaving it to each of the county's health departments to figure out what is going on, leaving these inconsistencies? Also, we've heard explanations about privacy, but can you clarify how any patient would actually be identified through basic information? And why can't the state mandate a process to make it uniform for everyone?
Dr. Phil.
Yes, thank you. We have heard this question a couple of times this week, and I appreciate that everyone wants more information. We're doing the best we can to strike the balance of protecting privacy as well as sharing information that's necessary for public health. What we are doing in terms of a nursing home outbreak or any of our congregate facilities is we are tracking all of those outbreaks. We are listing the counties in which they are in. Again, for these facilities, like a nursing home, the patients aren't coming in and out. It is the folks that work there that would be coming in and out in terms of understanding viral spread within a community. But those workers could live in that county or live outside that county. So we think we're trying to strike the right balance here between protecting privacy of the patients and the facility, as well as sharing the information that is necessary to protect public health, as well as be transparent and share information. We continue to update that information on our dashboard daily, and we will continue to release additional information to give us a better understanding of this virus as we continue to go forward. One in particular I know that we are working on is helping folks understand how many of our deaths have happened from folks who are living in nursing homes. So that is a piece of information that we can give. I'm pretty sure we updated it today, if not coming very soon. So we are trying to get new information, and I appreciate everyone's interest, but also understanding the balance that we need to strike around privacy while also protecting public health. Thank you.
Thank you. Next question, please.
Next question is from Ken Smith with WRAL-TV.
Governor, thanks for taking my question. I have two questions, actually, two different questions. I'm going to get to them right away. The first one is about testing. And are you working specifically with companies, and are you in a position to say which companies they are, or is this a supply chain issue? Secondly, we're going into Sunday services. We're getting word that some congregations are thinking about meeting based on the criteria you've set up for essential businesses, no more than 20% inside of one particular area. Can you once again clarify the situation surrounding religious gatherings?
Yes. Thank you. As for the testing part, we are working with a number of companies that have started the testing process. One of those right here, headquartered in North Carolina, LabCorp, Quest. Our hospitals are testing. Our universities are testing. So we have 13 labs across North Carolina that we are working with that have capacity to test. Our biggest issues involve the supply chain of having the supplies and personal protective equipment that we need in order to collect the samples to be able to get to those labs. We do have a lot of capacity in the labs. You heard Dr. Cohen mention about the fact that we do have some issues in certain regions of our state in trying to get samples to labs to make sure that they can get tested. But the working group that Dr. Cohen has put together, the fact that we have a group here at the North Carolina Emergency Operations Center out there on the market trying to get as much of these supplies, much of this personal protective equipment as we possibly can, is truly important. As for the issue with churches, I miss going to my church. I also care deeply about my congregation. I think it's irresponsible for some politicians to use faith to lure people into endangering themselves, their families, and their own congregation, especially at a time when the president's own guidelines don't advise NC reopening yet. We know that there is a reason why that federal guidelines and our guidelines prevent gatherings of more than 10 people. When people gather together and are around each other for a while, the evidence is overwhelming that the virus can spread so much more easily. And unfortunately, this has happened in churches at our state and across the country. I want very much for us to be able to ease restrictions as quickly as we possibly can, but we have to keep public safety at the forefront. Thank you. Next question, please.
Our final question will be from Reuben Jones with Spectrum News in Charlotte.
Yeah, thank you. I'd like to, if I could, Secretary Cohen, just go back to the nursing home question and regarding whether there's any concern, obviously the privacy of the residents, but the concern about the employees that are leaving those facilities and then going out in the community, whether you'd like to see more transparency regarding that. And regarding testing, when the state does get more capability of doing more testing, will nursing homes be a main priority for testing those residents because they have been affected so much by this? Thank you.
Sure. Let me take the second part first, because yes, you are right that the folks in our nursing home are some of our most vulnerable in the state. We know they're both medically frail and most likely to be over the age of 65. So they are certainly and will maintain a spot of high priority of testing. They're prioritized at our state lab, but are also using other partners to make sure that we're able to do and respond to outbreaks and do the testing that is appropriate, not just for the folks who are showing symptoms, but for all of the patients when we see an outbreak, to really get a good understanding of where the virus is in these nursing homes. And again, I think folks really need to understand related to releasing personal medical information. We do not release the names of people who have either been exposed or have COVID-19. It is very important that we strike the right balance between protecting personal medical information, as well as protecting the public health. We think about that tension every day. We take it very seriously. Both are important, and I think we are trying to strike the right balance to be able to share the information that we need to protect public health, to be able to respond, as well as protect privacy. I think the things that we can do right now to help make sure that virus does not spread in our community is to abide by the governor's order to stay at home. I know it's hard. I know that it's impacting so many lives, but the staying at home order is so important. We should only be leaving to do grocery shopping, and if you're working at an essential business or getting medical care, but otherwise staying at home. If you do need to go out, make sure you're doing that important hand hygiene and other kinds of good hygiene practices to make sure that we are staying socially distant as much as possible. Those are the things that are going to protect us over the long term. So those are the things I hope will continue to focus on over this next weekend. And thank you to everyone who is really working hard to stay home and save lives. Thanks.
Thank you all for being with us today. Stay home this weekend and stay safe. Thanks very much.